Hey guys, Dr. Tim here over at Physio, Orthopedics, and Performance inside of Cuyahoga Falls CrossFit. I wanted to go through today a very generalized tissue health and hip health program. So we're going to hit a bunch of different categories. They're not specific to an actual injury, but more things that you can be doing on your own, specific to problems that have been evaluated by myself or another professional. So we're going to put a couple things into different categories. We're going to go tissue length, so extensibility of the tissue health in terms of trigger point release. We're going to go joint capsule in terms of how the femur moves into the hip socket, into the acetabulum. And last, tissue strength in terms of your ability to resist force, to resist your workouts, and to avoid injury. So let's go tissue length initially, and let's talk about hip flexor. One thing you can do is a couch stretch for iliopsoas, hip flexor, TFL. You're going to be in this position with your foot behind you, knee on the ground, maybe a pillow on the ground. What you're going to do is you should feel a stretch through here. If you do not feel a stretch, you're going to shift your pelvis forward, hip flex forward a little bit, thrust forward a little bit. Should increase that stretch. Another thing you do is take that hand, same leg, reach to the ceiling, other hand reach towards the ground, and lean forward a little bit with your pelvis forward, not rotated this way, rotate it forward. Hold that position. With anything that's tissue length related, you're going to hold that stretch for at least 18 seconds, but probably go 30 seconds, 2 to 3 times on both sides. Tissue length for hip flexor, tissue length for hamstring. About 1,000 ways to do this. Let's go pretty simple. Dog leash, exercise band, something along those lines. You're going to go around the foot. You are going to keep your knee as straight as possible. You're going to lean back with your back flat on the ground, and you're coming up here until you feel tension right below this area. You know, if you start coming up here, you start to bend a little bit, it'll take the tension off. So you want that knee straight. You're going to pull into the hamstring. You can mess with that angle a little bit. You can bend the knee, go back a little bit farther. You might feel that lower. If your knee's very straight, you're going to be a little closer to the insertion point or the origin point. Either way, you're going to hold that position for about 30 seconds. Give it a couple rounds through, 2 to 3. Anything with tissue length is going to be in that same time duration. Another tissue length exercise for the adductor, so the muscles that run on the inside of your leg. Muscles that aren't really active in walking, but are very active in running or sprinting or squatting or lunging, an athletic muscle. You're going to have your feet together, hands on your feet. Your elbows are going to the inside of your legs, and you're pressing down. You should feel that tension all through the adductor area, which is like the groin type area. Shouldn't be sharp pain, just a stretch. You're going to hold this position for about 30 seconds. Repeat it a couple times and move on to the next one. So to make sure we're not missing anything, we've gone through hip flexor, we've gone through adductor, we've gone through hamstring. Let's go a little higher, go into glute, anything that could attach to the pelvis and be part of the symptoms that you're experiencing or the lack of mobility. And we're going to go into like a glute type stretch. There's 2 different ways you can do this. One is you are taking your knee towards your opposite shoulder. So you're going to go here, you're going to go opposite shoulder, you're going to feel the pull through this area, through this piriformis type area. You're going to hold that for about 30 seconds. Repeat a couple times. Number 2 will be felt differently. You're going to go into a figure 4 position. So I'm in this figure 4 position. My hands are shooting through my legs. I'm grabbing the leg that is straight, not the one that's bent to like the principal position. I'm pulling it towards my chest. It should be a different area, but still into that glute area. 30-second hold should get you through and permanently lengthen that tissue. Tissue health. Tissue health, we're looking for trigger points or not, spots that would feel tight to me if I was pushing onto that muscle, and will feel tender to you if you're rolling over that muscle. That's what you want to prioritize. In terms of pressure, if it makes you hold your breath, you're doing too much. If it feels sketchy, it is sketchy, so there should be no numbness, no tingling, nothing along those lines. But for the front portion, so we're talking hip flexor, we're talking TFL, we're talking a little bit of adductor, anything through here, I would go foam roller. You're going to go on your stomach, and basically the key hitting these positions is you're going to have to rotate your leg one way or the other. So I rotate to the outside and get into a TFL, I can get into hip flexor a little bit more straightforward. You'll feel in a different place. You're looking for the tender spots. Oh, there's one for me. Once I find that tender spot, I apply pressure and I oscillate on that area probably about 20 times. Look for another tender spot. I rotate my toe in, I can get to the adductor area. Oh, tender spot, oscillate through there. So go through, look for tender spots, spend about a minute. All right, so tissue health for hamstring and glute is a little bit different technique compared to getting into the hip flexor and adductor area. You need something like a softball. or a baseball, or this is sold on Rock Tape's website, which is nice too. Just something with some good density and some good mass in order to get deep into those muscles. The foam roller usually doesn't get as deep and isn't as specific in the hamstring and glute area. So for tissue health and looking for those trigger points and those knots again, we're using something a little bit different. So what you're going to do is you're going to sit on that ball, you're going to search for a tender spot. This surf's a little too squishy, something firmer than this, like a bench would work, you know, or a chair. Find a tender spot, I'm going to sit down. All I'm going to do is I'm going to move my leg back and forth. I'm going to flex, I'm going to extend passively, okay? So I'm not activating the muscle, I'm using my hand to move that leg back and forth. Now when we transition, we go into that glute area. It's a similar idea, but a different position. In that you're in a seated position, you have that same ball, you're sitting on it, you're looking for a tender spot. Once I find one, my knee is in a 90-degree position. It's going to fall to the ground. Use my opposite arm, to pick it back up. Falls to the ground, opposite arm to pick it back up. You're looking for that tender spot, you're finding it. You're hitting like 15 to 20 rotations, moving on to the next tender spot. Over time, these spots should become less. They shouldn't get more aggravated. This is as similar as we can get to the trigger point release that I do here in the clinic. Feel free to check out our website if you're interested in something like that. I can't give you a pack of needles and say good luck, so we try and stimulate with tissue health activities. Joint capsule mobility. So this is the front of your body, this is your femur, this is your leg, this is your hip. As you go into flexion, and as you're running and you're going to this position and your knee is going to your chest and you're going through that flexion into the hip, there should be a gliding motion that occurs. If this capsule that sits in this area and holds that joint in the socket is tight, every time you go into that flexion, you'll pinch at the top, and at some point you wear down that labrum, which kind of helps hold the joint, stabilize everything in socket. So the goal is to gap that joint a little bit and allow you to glide properly through that motion, all right? So what we do that is you do need a band with a little bit of decent thickness. It's attached to something like the rig. You're in a position where your leg is through, you're all the way up into your hip. So that band is pretty high up in my hip, into my groin area. I'm going to scoot back a little bit so I have a direct line of force into the rig, make sure that's in the correct position. Other band, could be a rope, doesn't really matter, you only need one actual band, is going to be wrapped around the foot. This band is so I don't activate any muscles. You need to relax the muscles in order to stretch the capsule, which is non-muscle tissue. You're going to go in this position. The band's up into the groin. From here, you're going to wing out to the side. Once I'm winged out to the side, take a deep belly breath in. I'm going to breathe out. As you breathe out, try and relax everything into the hip. That is super important. Everything's relaxed through here. You'll feel a deep stretch. It won't feel like a muscle stretch. If you feel this into your hamstring, you're doing it incorrectly. You need to bend that knee a little bit. That'll put the hamstring on slack. But in this position, you feel that deep into the capsule, a little bit like a gapping sensation. You can't overdo this, so this isn't something you should do every single day for the rest of your life. If anything throughout here flares you up, irritates your pain, you need to cut out of that program right away. All right? So there is capsule mobility for the hip capsule. All right, tissue strength. So around my knees, I have this red, thin band. It's a stretchy band. They're pretty common in any PT or chiropractic clinic called a TheraBand. I think that's the brand name. You get them on Amazon. Know that the thickness of the band, how tight it is, will increase the strain of this activity, make it a little bit tougher for you. Also, if the band is closer to your feet, it makes it harder. If it's closer to your knees, it makes it easier. The closer you get to the joint, it decreases that moment arm, makes the exercise easier for yourself. All right, so farther away, the band by your ankles is the toughest position. So I have this around my hips right here. In terms of hip muscles that are activating, they need to be activating. There's some lateral stabilizers, abductors, there's flexion, there are extenders. We got to hit everything. There's a million different ways to do this. Let's just talk about one today. All right, so in this program, this band is going around your ankles. You're in a deep squat position. You're thinking if there's like spikes above your head, you don't want to be going up and down. You want to be at the same level, not get those spikes. In this position, my toes are pointing forward. I'm taking a giant step. I'm going to the side. I'm going to the left until I feel a decent amount of fatigue into that left hip. I'm going to stop. I'm going to the right side until I found a decent amount of fatigue into the right hip. All right, so there's side-to-side motion. Same position. I'm going to go up and out. I'm going to go up and out until you fatigue. Once you fatigue, you're going to stop. You can take a break. You're going to go down and back. You're going to go down and back. All right, that will strengthen three different muscle groups that are important for injury prevention and put you in a separate category. Again, there's a million ways to do this. As a pretty simple one, so I would start with that. I'll talk to you guys soon. Feel free to check out my website, physio, physio, ortho, ortho, perform.com. I'm Dr. Tim, and I'll talk to you guys soon.